I was routinely seeing more than 30 patients in an 8-hour day.
I just was working so much and so stressed.
One day my wife said, you need to make a change because you're not bringing the stuff home anymore.
I was a referralist. Just go here, because you don't have time to deal with anything.
I got 7 minutes to meet with you, man. Here you go. Here's the drugs. Go on. Go to the pharmacy.
Primary care doctors, we're done. We are so screwed in the insurance-based system.
We have a special perspective in this movement, so we know how disease processes can get monetized rather than addressed.
And that's actually what led me into the benefit space, was a $600,000 pacemaker claim off a medical error.
I don't separate care and cost. I can break people by sending them to the wrong places, and I know that.
They end up going to 5 specialists. All of those could be handled by a 160-minute visit.
And over 30% of just my patients are misdiagnosed. We have to start doing things differently.
If you ask me to pick one word about the future of our healthcare right now, it's unsustainable.
The pain of the status quo exceeds the pain of making a change.
Clinicians like ourselves stepped out and said, we're not going to deal with this anymore.
In the patient-centered model, the lines of authority are structured differently.
And the patient and the doctor are at the hub.
We give patients long visits, direct access and support. They enjoy transparency in pricing.
We have the time to provide true informed consent before we give them some sort of therapeutic.
You're taking better care of people, you're spending more time with people, you're sending them to more cost-effective solutions.
They rave about it. I mean, they're our best ambassadors for our plan.
It's impressive for an employee or a patient that is used to being treated like cattle, and it's at a reasonable price that people can afford, but it's also at a price that I feel is fair to me as a physician.
And the first year with our largest employer group, we lowered emergency room visits by 67%.
How do we achieve these outcomes? And to be quite frank, we do it pretty easily.
Here's the price, there's a provider, we have a buyer, a seller. Let's just simplify things.
More and more buyers are discovering better ways to buy from physicians and facilities directly.
Turning them into consumers of healthcare rather than just being a claimant.
The whole healthcare system is just ready to see a different way of doing it.
I'm spoiled now. Sometimes I forget how bad it was.
It's been an absolute joy to be part of this part of medicine.
It's very liberating,
It is very liberating.
I'm enjoying this so much more.
I always say I'd go scrub toilets at a Taco Bell bathroom before I go back to working in the system.
This is truly, the way forward.
This movement, this sold-out conference, is a manifestation of the power of our message.
This is the obvious thing that the U.S. needs and that we all need right now, is to provide more direct access, in a direct-to-consumer model with an affordable and transparent price that doesn't include networks, that doesn't include insurance, to get people connected to care.